Tooth extraction is a routine dental procedure, and with a few steps you can ensure a comfortable and relatively pain-free experience. A fresh extraction site will bleed excessively unless a gauze pack is properly positioned in the area. The gauze used should be moderately moist in order to not get tangled in the cloth. If the gauze is dry, it would pull out the cloth during removal, and therefore delay the healing process. As you see in the picture, the gauze should be properly sized for the area of extraction. A large or malpositioned gauze pack is not effective in controlling bleeding, because the pressure of biting is not precisely directed onto the socket. You should bite firmly on the gauze for at least 30 minutes and not chew on it. It is normal for a fresh extraction site to ooze slightly for 24 hours after the extraction procedure. So what to do to lower the risk of bleeding? Talking should be kept to a minimum for at least an hour. Nicotine in cigars might interfere with wound healing, so smoking should be limited or stopped until the wound fully heals. If the bleeding is more than a slight ooze, use a second gauze for at least an hour. If bleeding didn't stop, you could put a tea bag on the socket for about 30 minutes. You shouldn't spit for at least 12 hours after surgery. If the blood in your mouth makes you uncomfortable, you should put a gauze on the extraction site and at the same time swallow your saliva. Heavy exercise should be kept to a minimum 12 to 24 hours after surgery to prevent a rise in blood pressure and decrease the risk of bleeding. Prolonged oozing, bright red bleeding, or large clots in the patient's mouth are indications for a return visit. Having a soft diet the day after surgery is preferred. Management of pain. You should start taking acetaminophen and ibuprofen immediately after surgery, even if the pain hasn't started yet or the surgery was so minor that you don't expect a great deal of pain. You should keep in mind that most analgesics take about 60 to 90 minutes to reach their maximum effectiveness. Some discomfort is to be expected. The goal of analgesic medication is management of pain and not elimination of all discomfort. The pain would be at its peak around 12 hours after surgery. By knowing that, you can get prepared for the pain and use the right drugs to counter it. Excessive pain usually doesn't last more than 2 hours after surgery, and common post-operative pains are manageable with over-the-counter analgesics. For keeping your hygiene, on the same day as the surgery, you should brush your teeth that are away from the operating site. The next day, you could rinse your mouth with warm, salt water, and hygiene maintenance should go back to normal 2 to 3 days after the surgery. Diet in the first 12 hours should be soft and have moderately cool temperature, as cold foods keep the local area comfortable. Many dentists suggest using ice cream after extraction, but that also has its own risks and is not the healthiest option. Edema only occurs in complex situations and complex surgeries. Swelling reaches its maximum amount 36 to 48 hours after surgery. If swelling continues onto the third day, it might be a sign of infection. Sleeping in a more upright position by using extra pillows will help reduce facial edema because more blood will leave the head and neck area and go towards the lower trunk. A moderate amount of swelling is a normal and healthy reaction, and is not something to worry about. Trismus means that you aren't able to open your mouth to its full extent. The muscle most likely to be involved is the medial pterygoid muscle, which may be penetrated by the local anesthetic needle during the inferior alveolar nerve block. If you feel a slight muscle cramp when opening your mouth, or have difficulty fully opening your mouth, it might be due to the swelling present in your face, and will resolve on its own in a period of 7 days. If a patient who has had surgery begins to develop swelling with surface redness, fever, pain, or all of these symptoms on the third post-operative day or later, it can be assumed that the patient has developed an infection until proven otherwise. You should make an earlier visit to your dentist for any of these 3 reasons. 1. Prolonged oozing, bright red bleeding, or large clots present in the mouth. Number 2. Pain that does not respond to medication. And number 3. Suspected infection. If you follow the steps explained in this video, It will guarantee you a more comfortable and painless experience. Thanks for watching and hope to see you in the next one.